And now we have Dr. Benavegna. So thank you for coming. And then the next person will be one more parent of a child, Diasha Jackson.
Good morning. Good morning. Thank you for the opportunity to address the dental health items in the state budget. I'm Dr. Vincent Benavegna. I'm an oral surgeon with my main offices in East Lansing. I have an office in Charlotte, Michigan, and also in Grand Ledge, Michigan. I'm currently president-elect of the Michigan Dental Association and volunteer with the Michigan Donated Dental Services Program, and have been with this program since its inception in 1995. The Michigan Dental Association supports a significant increase in investment in and restructuring of Michigan's Medicaid dental programs based on the following principles to ensure equitable access for Michigan's adult Medicaid recipients: ease of administration for patients and providers, patients to be issued private insurance cards, allow dentists who are non-participating with the insurance administrator to participate with the government program, reimbursement rate at 60% of UCR or more, adequate provider network, have a plan to increase utilization, and have a plan to decrease patient no-show rate, access to data and reports on a timely basis. Many of these principles are built into the highly successful Healthy Kids dental program and are proven to reduce disparities, increase access, and improve health outcomes. Several of these principles were included in Healthy Michigan Plan. However, as data from the University of Michigan shows, plan administrators were not required to provide adequate reimbursement, which caused dentist participation to decline across time. Rate protection must be built into the plan to ensure sustainability. The Michigan Dental Association and its members also supports necessary increased investment in Medicaid reimbursement for hospitals and ambulatory surgical centers facilities to provide general anesthesia for dental patients who require treatment in this setting due to medical necessity. The MDA estimates a larger increase in funding is needed than what is contained with the governor's proposal. There's currently a backlog of approximately 10,000 Michigan dental patients who meet the appropriate established medical criteria to receive dental treatment under general anesthesia but are unable to access the care. The current backlog is due in part to the need for hospitals to pause non-life-threatening operating room cases during the COVID-19 pandemic. However, prior to the pandemic, hospitals were limiting or eliminating these patients from their operating rooms due to the extremely low reimbursement of approximately $200 per case. Hospitals report losing roughly $1,500 per case to provide the necessary staffing, supplies, and space needed. An estimated 5,000 cases annually require this level of care due to the patient's medical needs, disability, or very young age in combination with severe dental disease. The Michigan Dental Association estimates an appropriate rate of approximately $2,300 per case for this facility fee to ensure parity with the cost of providing care and to incentivize hospitals and ambulatory surgical centers to accept these patients. In addition, and not addressed within the governor's proposal, a similarly low rate, near $200 per patient, is paid to the anesthesia professional. Dental patients typically require nasal intubation because they're working in their mouth, which is more complicated than other methods. These patients require an average of 90 minutes of general anesthesia. The MDA supports increasing reimbursement from approximately $200 per case to approximately $2,300 per case for the anesthesia provider. The last budget item the MDA would like to call to your attention is funding for the Michigan Dental Donated Services Program. This program was established through a partnership between the Michigan Dental Association, Michigan Department of Health and Human Services, and Dental Lifetime Network in 1995. Nearly $1 million in donated care is provided annually. The program recently reached the milestone of $25 million in donated treatment since it began. The patients served are those who are elderly or who have permanent disability or chronic illness and are unable to access treatment through any other program. Patients are in need of extensive treatment and often have dental infection that complicates their medical conditions and pain that keeps them from being able to eat well. As a volunteer dentist myself, I have seen firsthand the positive impact this program makes on the health and lives of people it serves. The current annual $150,000 MDHHS grant funds the program's administrative costs and 2 full-time caseworkers who match eligible patients with volunteer dentists and volunteer dental laboratories. Funds also pay for some dental laboratory services. The MDA is seeking an additional $50,000 for a total grant of $200,000 to support staff and provide outreach to eligible marginalized populations. This includes paid advertising in publications and social media targeting eligible audiences, translation services to reach those who may speak a primary language other than English, and targeted outreach to specific communities of interest such as tribal elders and veterans. Thank you for your time and consideration of these requests to support the oral health and overall health needs of your constituents.
Thank you. Thank you
Thanks.
for what you're doing.
Thank you.